relates to the field of music therapy. So what I'm going to talk about today is what music therapy is, a brief history of it, what it includes, where it's practiced, and its effectiveness. So what is music therapy? Music therapy is defined as the clinical and evidence-based use of music by a healthcare professional in order to promote healing and a better quality of life for patients. It can help behavioral and emotional disorders like depression and bipolar disorder, as well as developmental disorders such as autism. What it does is it really encourages exploration and expression of emotion. It encourages social interaction, and it can relieve symptoms of disease and a variety of other purposes that I'll get into later. The main idea behind it is that music actually affects our brain waves and our brain circulation and the stress hormones in our body, and it's been shown to improve quality of life and have many positive effects on people with varying types of disorders. So a brief history, the idea of music as a healing influence can be traced back to the teachings of Aristotle and Plato. And also Mozart's compositions have been shown to have beneficial effects on the human psyche, and they're believed to help brain development and performance of mental tasks, and that's what's known as the Mozart effect. But the discipline as it's known, the 20th century discipline as it's known today, really started after World War II when musicians used to go to veterans hospitals and play for the vets who were suffering from shell shock, and their physical and emotional responses were observed. And the first music therapy degree program was founded at Michigan State in 1944, and the American Music Therapy Association was founded in 1988. So what a music therapy session includes, it really depends on the patient, but it often includes improv, making music like singing, songwriting, learning how to play an instrument, listening to and discussing music with the therapist, moving to music, music performance, that kind of thing. But the type of therapy given really varies from patient to patient, because someone with like a mood disorder like depression is going to have different needs and different type of therapy than, say, someone suffering from a physical disease like cancer. And where it's practiced, music therapy can be practiced in a lot of different institutions, but probably the most common is hospitals, where it's used to alleviate pain, elevate mood, counteract depression, induce sleep. It really just serves as like a calming presence in the lives of these patients. It's also used in psychiatric facilities for people suffering from like depression and other mood disorders. And for them, it really encourages them to explore their feelings, make positive changes in their mood or emotional state, and give them like a sense of control over their life. And as well as it's used in schools, mostly with children, and it's been shown to raise the self-esteem of students. Now in terms of effectiveness, music therapy can't cure a disease, but it has been proved to alleviate symptoms when it's done correctly by a professional. Like I said earlier, treatment really must be decided on a case-to-case basis based on like the type of disorder or illness that the person's suffering from. And so it's really, there's a lot of trial and error involved to figure out what works for a specific patient. And it's often used along with other forms of treatment like medication if that's necessary. So in conclusion, I told you what music therapy is, a short history of it, what it includes, where it's practiced, and its effectiveness. And I think it's just really important to observe and understand that music can have a real effect on our minds and bodies and can serve as a positive influence in our life. And I just wanted to end with a quote by Billy Joel, who said, "I think music in itself is healing. It's an explosive expression of humanity. It's something we are all touched